Hi everyone, today we will be demystifying MAiD. The topics that will be covered in this video include: what is MAiD? A brief history on MAiD, the organ donation problem, donor eligibility, limitations, the problems, eligibility expansion, and lastly we'll leave you with a question where you are open to share your opinions regarding MAiD. So, what is MAiD? MAiD, or medical assistance in dying, is a procedure in which a health professional, with the use of specific drugs, helps an individual end their life. This is usually requested by terminally ill patients who are in dire pain with a prognosis that suggests the individuals have less than 6 months to live. Being in control of one's death, and therefore dying with dignity, is an important issue that is now being highlighted as the stigma surrounding MAiD is slowly eradicating. To be eligible to receive MAiD in Canada, one must be 18 or older and have decision-making capacity, must be mentally competent, have public healthcare coverage such as OHIP, come to the decision to receive MAiD on their own with no external pressures or influences, provide consent to receive MAiD after being provided with all information surrounding it, and the individual must have an incurable illness or disability that causes them physical or psychological pain or suffering that cannot be eased. Individuals with mental illnesses that would like to receive MAiD in Canada will be able to do so in March of 2024. It is also important to highlight that there are two distinct types of MAiD procedures, one in which direct administration of a specific substance results in death, which is known as clinician-administered MAiD, and another in which a specific drug is prescribed for the individual seeking MAiD that they take, which results in death, known as self-administered MAiD. Now, onto a brief history of MAiD. In 2015, a court case titled Carter v. Canada resulted in the modification of Canadian laws, changing the ability to receive MAiD to align with the Canadian Charter of Rights and Freedoms. This then led to the legalization of MAiD by the Canadian government for individuals with foreseeable deaths in June of 2016. But in March of 2021, this was expanded to include patients undergoing immense and incurable suffering and pain. In comparison to other countries like Switzerland, Canada was seen as lagging behind in their laws surrounding MAiD legality. Before MAiD became legal in Canada, many Canadians seeking MAiD would travel to other countries like Switzerland to receive MAiD. The other side of this problem is that there is a shortage in organ donations worldwide, but it is especially felt in North America. In Canada specifically, the problem is dire, with 1.5 individuals waiting for an organ donation for each transplant recipient. In order for MAiD patients to be eligible to donate their organs, they need to be under the age of 80, have no presence of HIV or metastatic cancer, and be willing to undergo their MAiD procedure within a hospital. There are limitations associated with this process though, as only organs that are obtained within a hospital setting from MAiD patients can be utilized for transplants. That is, if a patient undergoes MAiD outside of a hospital, their organs are ineligible for transplantation. Organs need to be quickly harvested for transplantation, which is where another limitation arises regarding paperwork, especially surrounding written consent forms. Finally, many children are stuck on the organ transplant list as children require smaller organ sizes, such that their donors also need to be children. As only adults can request to undergo MAiD, the organ transplant waiting list for children is not likely to diminish. There are ethical issues surrounding MAiD and organ donation by these means. For one, individuals can be indirectly pressured by external sources to end their lives for the sole purpose of harvesting their organs. If an individual with mental illnesses are allowed to seek MAiD, they would be especially vulnerable to this outside pressure from authorities or individuals that may view the life of an individual waiting for an organ donation to be more superior or valuable than the life of a mentally ill patient. Another problem that worries psychiatrists is that mentally ill patients that could recover will opt to receive MAiD before they have the opportunity to get better. Palliative care physicians worry that their patients diagnosed with dementia are no longer able to consent to receiving MAiD, and the decision-making process becomes tricky in these situations, as decision-making on behalf of the patient will likely fall on their caregiver, having a high emotional toll on them. Thus, there needs to be support in place for these individuals, and instead of taking a patient-centered approach to end-of-life care, it should be modified to a family-centered approach. Overall, healthcare providers are concerned that with the expansion of MAiD and subsequent organ donation, This could promote and increase the number of MAiD requests for individuals who would in other cases be weary regarding seeking out MAiD. As highlighted before, the Canadian government is likely to expand MAiD eligibility to mentally ill individuals in March of 2024. This was supposed to happen in March of 2023, but was delayed. The Canadian government is also looking at expanding eligibility to include individuals who they consider mature minors. This can introduce a whole new slew of ethical issues surrounding external pressures leading to MAiD in order to obtain organs. Now you have the opportunity to share your opinions regarding MAiD. What are your thoughts regarding MAiD? Should it be further expanded to include more individuals or limited to include less? Feel free to share your opinions regarding MAiD in the comments section below. Please remember to be mindful and respectful of others' opinions, as this can be quite a controversial issue. Thanks for watching, and don't forget to subscribe to the Demystifying Medicine YouTube channel.